All right, good afternoon, everyone. Thanks for joining us for our media briefing today. We're going to get started. We have a kind of a full list, a full agenda for you today of folks with some interesting things to talk about. Let's start with Cindy Burnham, who's with Animal Services. She's going to share a little bit about our texting program for lost and found pets, which may have gotten a workout over this last weekend. Hi, Cindy. And I am not.
Now you're hearing me, correct?
I'm hearing you now. That's excellent. Happy Monday.
Thank you. Hi, I'm Cindy Burnham. I'm with Hitchcock Road Animal Services, which includes Salinas and Monterey County. And we wanted to share a new program that we've recently started, which is a very simple program aimed at helping get pet owners who've either lost or found a pet the information that they need. So as you can see by my my background, it's very simple. If you find a pet or find an animal, you text 831-FOUND to 56525, and you will start getting links to our found pet report, where to post on social media, because we found that social media is very good at helping pet owners locate their pets. Tips on getting your pets or getting the pet scan for a microchip, because that's also important and can lead back to an owner. Tips on making signs, and also registering on findingrover.com, which is a pet facial recognition program that we're a partner of, which can also help pet owners look for their pets. On the other side, if you've lost your pet, you can text 831-LOST to 56525, and you'll immediately get a link to our lost pet forms. You'll get links to the pets that are currently in the shelter, tips or videos on how to find your lost pet. A lot of people think if you just put up one little sign, that will help, but there's some proven ways that our friends at Front Street Animal Shelter in Sacramento have found, and they've created some really good videos. So we're sharing those videos for people to help find their pets. We link to other shelters. We made a list of all the social media sites that folks can go to look at: Craigslist, Facebook. There's some very active sites out there that are helping pets get reunited. And again, linking to findingrover.com, which is a facial recognition program that helps to link owners and their pets. And every shelter in Monterey County is a Finding Rover partner. So that's another free tool for folks. And then what that does is, for lost pets, is every 3 days, you continue to get a text reminder of, here's the animals in the shelter. Have you done this? Don't forget this. And so it's just a simple way we want to get pet owners reunited with their pets. That's our first goal. And now that we're in a new COVID procedures with limiting folks, we're trying to really push as much information out there as possible. So that's it, if there's any questions.
Thank you very much, Cindy, for that update. And I know this rolled out a little while ago, but people, especially after 4th of July, people may be looking for a dog or a cat. If you would stand by in case we have any questions from the press after our speakers finish, that would be great. Now we're going to move on to Emily Nichols. She's in-home supportive services and public authority program manager with our Department of Social Services. She's going to tell us a little bit about the electronic visit verification program, which had a little bit of a delay getting launched due to pandemic, but is doing very well. Hi, Emily.
Hi there. So I'm the program manager for in-home supportive services for Monterey County. And that is a program that uses Medi-Cal dollars to provide low-income seniors and people with disabilities with being able to pay for caregivers to care for them in the home, so that they don't have to go into skilled nursing facilities and that sort of thing. So historically, the caregivers and the recipients have completed timesheets on paper. And so there was a federal mandate a couple of years ago that said you were going to have to switch to electronic visit verification, meaning all timesheets will be filled out either electronically or by telephone. And California, this is a federal mandate, so all states have to do this, and California was able to get an extension of this mandate through the end of December of this year. But as of January 1 of 2021, everybody's got to be using either telephone or electronic timesheets. And just to understand the significance of this, we have about 5,200 recipients and about 4,700 caregivers in this program. So that's about 10,000 people that we have to shift from paper timesheets to electronic or telephone timesheets. And I'm proud to say that we are actually at 86% compliance with this as of today. We got our latest statistics. We had started last year with a lot of supports to get people on this because for a lot of seniors, it's really hard to use technology. So we've been trying to encourage them to use telephone if they're more comfortable with that. So we're continuing to do outreach to try to assist people with getting signed up, but we only have until the end of the year to get the remaining 1,400 people signed up for electronic or telephone timesheets. So I don't know if anyone has any questions. It's a pretty unique program.
Thank you, Emily. If you just stay with us, we'll take questions after all of our speakers have completed. So hang in there. And next, we're going to go to Diana Jimenez, the Deputy Director for Social Services, who's been our Great Plates Delivered person, and she has an update for us.
Good afternoon, everyone. Just as a reminder, the Great Plates Delivered program was started on May 5th. And it had two goals. The first one was to help seniors age 60 and over at high risk from COVID to stay home and stay healthy by delivering 3 nutritious meals a day. And the second goal was to provide essential economic stimulus to local businesses struggling to stay afloat during the COVID-19 crisis. The Great Plates Delivered program was extended through July 10th by FEMA, and at this point, we're waiting to hear from them to see if it will be extended further. The request to extend is submitted by the state, and it can only be submitted every 30 days. So we're approaching the 30th day, so our hope is that it will be extended. At this point, we have exceeded our enrollment goal of 200 and are currently serving 210 seniors, 3 meals a day, 7 days a week. And we unfortunately are not accepting any more applications. The seniors are spread out throughout Monterey County. So we have 15 from North Monterey County, 49 from the Peninsula, 13 from Marina, 23 from South County, 107 from Salinas, and 3 from Spreckles. Seaside City has their own program. We selected 7 restaurants to be part of the Great Plates Delivered program, and they are also geographically spread out across the county. And these 7 restaurants were able to employ 35 staff members who help support the program. And the businesses or restaurants include Stevie's Family Restaurant from Prunedale, Linda's Taqueria from Gonzales, the Cork and Plow from King City, Coastal Cuisine and Catering from Monterey, Denny's Restaurant from Marina, the Main Street Bakery and Catering from Salinas, and Monterey Coast Brewery from Salinas. I'd like to thank United Way and the 211 staff for helping us screen Great Plates participants. I'd also like to acknowledge and thank AAA DSS Management Analyst Kathleen Murray Phillips for overseeing the program and its implementation, and Senior Secretary Sandra Sylvia, who helped enroll Great Plates Delivered participants. And lastly, I'd like to thank you, the media, for helping us spread the word about this great program and helping us reach seniors throughout Monterey County. Thank you.
Thanks very much, Diana. It's really nice to be able to share great news about a great program. If you would stand by in case we have any questions for you. I see Dr. Moreno has been able to join us on the call, and so we're always happy to hear from him. Good afternoon, Dr. Moreno.
Let's see. Whoops. Good afternoon, Maya.
Thanks for joining us.
Yeah, sure. Hello, everybody. So as far as reporting updates from the health department, I can say that we're still seeing, as far as the demographics for COVID-19, we're still seeing the highest rates in ages 25 to 44. Latinos still making up the majority of cases in Monterey County, and by region, Salinas still has the highest number of confirmed cases in the county. And finally, by industry, ag is still leading the sectors in terms of the numbers of confirmed cases of COVID-19. And then as far as data monitoring, the state continues to collect data from our county and is tracking a variety of indicators. And as of this morning, Monterey County continues to exceed the state's indicator for 14-day case rate, and also for positivity rate. So the threshold for positivity rate by the state is 8%, meaning 8% of all the tests that are performed are positive. So that's the threshold, and we're at 8.1%. So we're just above the state's threshold for that at this point. As many of you are aware, the state has identified counties that have exceeded the thresholds for a certain amount of time, and based on that, those counties have been required to close certain parts of businesses. At this time, we continue to have communications with the state as they monitor Monterey County. But at this time, we've not been told by the California Department of Public Health or the governor's office that Monterey County is required to close those similar businesses. So I think it's important for everyone to remember that one of the reasons that we're having this increase in case rates and positivity rates is because we have opened up businesses. It's good for the economy, but it does create additional opportunities for people to be exposed when they leave their home. And if they do get exposed when they leave their home, they can bring the COVID back to their household and possibly expose family members. So for that reason, it's still very, very important that if you do leave your home, to cover your face, and also when you have the opportunity outside of your home, wash your hands or use hand sanitizer, and keep distance. Keep distance from people who aren't in your household. And so those are the main things that we can do to try to, again, continue to slow down the spread of the virus. There are parts of the state where the rates are far above our rates, and it's contributing to an increase in the number of people requiring hospitalization in their local hospitals. So our hospitals aren't near capacity like some other hospitals in other counties in Monterey in the state. But if we want to keep it that way, we're all going to have to continue to do what we can to prevent unnecessary exposures to the virus when we're out in public. So I'll go ahead and stop there, Maya.
Thanks very much, Dr. Moreno. We might as well just go ahead then and get right on to the questions that people have. It's been a busy last 5 days or so. Let's start with this one. Has the county, you touched on this a little bit, but has the county heard from the state regarding its status on the watch list and a potential shutdown? And could you explain this process and how it specifically applies to Monterey County?
Sure. So we are in communication with folks in the state. They let us know that we've exceeded the case rate, and they want to know, what are some of the causes? What do we think is going on down here that might explain why the rates are going up? So we've had those communications, and they're thankful, and then they go back to share that with California Department of Public Health leadership. And the process, what I think the process is going to be is that at some point, if the state health officer has sufficient concern that COVID-19 is spreading too rapidly here in Monterey County, then the state health officer could then notify us that Monterey County will also have to close the certain businesses like they have in other counties. So specifically, there's what other counties have had to do already is close the indoor seating for dine-in restaurants. Have to close their indoor seating to customers. It's one example, but they can still have outdoor seating if they choose to do so. Wineries and tasting rooms have had to close their indoor services, and family entertainment centers and movie theaters have also had to close their indoor services and attractions to customers. Family entertainment centers have been able to remain open in terms of their outdoor services, and drive-in movie theaters would have to follow drive-in movie theater guidance as well. And then a couple of the areas that have been closed in other counties, indoor attractions at the zoos and museums, although they can continue to operate their outdoor activities, and then card rooms would have to close their indoor services as well. So those are, and in the counties that have closed those services, orders have been issued to close for at least 3 weeks, and then a determination would be made at a later time to determine whether or not that would be extended or changed in some way.
Thank you. And then does the county have to meet all of the state metrics before being taken off the watch list, or just one or a few of them? Is there any discretion on that at the state or county level?
So that's a very good question. I really can't provide a detailed answer because I'm not involved. None of us here at the local level are involved with the actual calculation of the rates. That's state staff, and they're doing the calculations and they're posting on the website, and then they're making a determination with the state health officer as to whether or not certain counties need to reimpose restrictions. So at this point, we have communication with the state, and they basically tell us what our standing is. So yeah, we've been on the watch list for a few days now, and we'll have to wait to hear from the state again as to whether or not they want to continue to monitor us, or if they're going to make a recommendation. So that's about as detailed as I can give based on my role and what I know.
Thank you, Dr. Moreno. And this is a question for Cindy Burnham. How many pets or stray animals were reported or lost over the weekend? And do you have a comparison from last year?
Thank you. We're still collecting our stats. We actually don't tend to see a huge increase until the weekend or the few days after July 4th. We did get in only 3 dogs on the actual holiday, but as you know, fireworks continue to go off. They've been going off for a few weeks. So we're looking to start collecting that data probably this time next week, so that we can compare that to the increases that we saw from both shelters, because now our statistics are kind of combined as we're all in one building. So, but on July 4th itself, there was only 3 dogs that came in.
Thanks very much. Moving on to back to health-related questions. Dr. Moreno, this one is for you. Has the county been on the state monitoring list for 3 consecutive days at this point? And what would be the date for closing bars or closing indoor operations for applicable sectors? You touched a little bit on that earlier, but perhaps you could speak more to it.
Sure. So all I can say is that we've been notified that we're on the that watch list, or we've been, as the state says, we've been flagged, and that's all I can say at this point. It just, really is, as far as a date, it really depends on the state health officer making a determination that intervention is required and restrictions need to go back in place. So a date, if that happens, the date will be determined on when the state health officer makes that determination, and so we'll. So I don't have an anticipated date of this happening if it does happen.
Thanks very much. Another question for you here. Does the health department plan on doing anything differently to try to control the continued spike in cases in Salinas and the Salinas Valley?
So the county has the health department is just one department in the county. The county with other departments have been working to increase messaging to our communities that have been hardest hit by COVID-19. And actually, I think Karen Smith is on the line. She might be able to give more details as to some of, or you may as well, some more details as to what the type of outreach and media outreach, radio outreach, social media outreach the county has been doing.
Karen, do you want to speak to this? We could tag team this one.
Okay, so there's been a radio campaign for probably 3 weeks now, both on English and Spanish. There's a TV campaign that started, and the billboard, one billboard is up and it's on Market Street, but I'm not sure where on Market Street.
I believe it's across from Sacred Heart. And there are also going to be, I believe, a total of 8 billboards going up with the important messages of the things we've been saying saying so often, just showing them in a really big new way. Cover your face, wash your hands, social distance. There are also going to be we're hearing about some celebrity radio announcements coming, so people will be wanting to listen for that. People talking about testing and really encouraging testing and safe practices. And that's been a really strong coordinated effort to get the word out into our community and in the South County, in Salinas, but throughout the county, because the whole county is the patient. Is that correct, Karen? Can I call the county the patient?
The county is the patient. It's Dr. Moreno's patient. And also the hospitals are involved in getting the message out, and they have a program where they go out into, they have nurses that go out into the fields and talk to groups about safe practices and what to expect and what COVID is.
So I think that covers most of it. If anyone has more questions about that, they can call either one of us directly, and we can fill in anything that we might have missed. I have a question for Diana Jimenez. If you could verify the number of restaurants that are in the Great Plates program, is 6 or 7 restaurants?
It is 7. We added a second one in Salinas because of the volume of participants from Salinas area. We had 107.
All right, thanks very much. Back to Dr. Moreno. Dr. Moreno you predicted we would get more COVID cases as a result of the public protests in Monterey County a few weeks ago. Has the health department confirmed any cases stemming from this protest, and if so, how many?
Thanks. So anytime that someone leaves their home and engages with people who are not from their household, that adds an increased risk, regardless of why they're leaving their home and regardless of why they're interacting with other households. And so we have an increase in, what I can tell you is we have an increase in COVID activity countywide. So we're seeing it, and we're seeing it in many variety of different workplaces. We're seeing it in related to household exposures. We're seeing it in congregate living facilities. We're seeing it in a variety of other congregate living situations. So there is, although we're seeing a lot more of it in in the farm working community, for example, by sector, every sector is being impacted. So specifically with regards to people who are gathering to express their opinion in large group gatherings, that's just one way that COVID, an additional way that COVID can be spread. So whether you're deciding to express your opinion in large group gatherings, or whether you're just going to work, or you're going to a work site to seeking services, in all settings, people really need to keep 6 foot distance away from other people who aren't from their household, and also cover their face and use face coverings and wash your hands or at least use hand sanitizer frequently.
Thank you, Dr. Moreno. I have a question here about how many current hospitalizations for COVID are there in Monterey County? Dr. Moreno, unless you want to speak to this, there is a tool on the health department's COVID page that links to the state where hospitalizations are tracked. Is that the correct place to find that information, Dr. Moreno? And I'm not hearing anything.
As far as hospitalizations, yeah, if people would, could go to our website, they can look at the indicator page, and we're tracking. Really, one of the things that we're tracking on our indicator page is looking at the rate of change of hospitalizations, and what we know that there's a chance that the hospital census, which is basically the number of hospital people who are hospitalized on a daily basis during a pandemic, would be expected to rise hopefully slowly over time. It'll rise, but hopefully slowly. And so if we have a low rate of change, that's at least better than a rapid increase in the number of hospitalizations from day to day, which some states and cities have been experiencing. So we've hovered around 5% increase, more or less. So as of today, or the most recent information here, at least locally, we have over the last 7 days, we've had an average increase across our hospitals of a 7% increase in the number of people that are hospitalized in our 4 facilities. And so that also goes along with the increase in case rate that we've been experiencing for the last week or two. So again, it's just another reminder that if we are successful in slowing down the spread of the virus, then our hospitals will not be overrun, and any one of us who requires hospital level care will be able to receive the level of care that we require when we need it. But on the other hand, if people continue to refuse to cover their face or aren't covering their face using face coverings correctly, or people are going out, leaving their homes without a legitimate reason to go out and leave their home, that's going to increase the spread, which can increase the number of cases. And as we have more cases occur, we're going to have more illnesses, and that might lead to a rapid rise in hospitalization. So that's what we really want to try to avoid, overrunning our hospital and overrunning and overworking our healthcare workers.
Thank you, Dr. Moreno. Another question for you on testing. What is the long-term plan for testing? When sites close, how will people be able to get tested?
So at this point, the state of California still is working to expand testing. So that's still the goal in the conversations we've had with California health officials from the California Department of Public Health. And so we'll here in Monterey County, we'll continue to work with the state to identify ways to continue to provide, make testing accessible to folks here in the county. As a reminder, if people are feeling ill and or if people have symptoms of COVID-19 and they want to get tested and they're not feeling well, the first thing that people should do if they have a healthcare provider is to call their healthcare provider and talk about how they're feeling in their situation. And if people don't have a healthcare provider but want some health advice, they can call one of the hospital COVID advice lines to get some guidance on their particular their symptoms and whether they should take any action. And testing is helpful for people who are symptomatic to let them know if they have COVID, because if they have COVID, then they need to isolate themselves and prevent further spread among their friends and their family. So so testing is still important, and we'll continue to work with the state to do what we can to make sure that the testing is available through private sources or healthcare facilities and also through our public health laboratory as well.
Thank you for that. Another question for you. If the state does require closures with Monterey County, how would you expect that announcement to be made? Would the state announce it publicly, and would Monterey County be informed ahead of time?
I don't know that we'll be informed ahead of time. I think we'll have to we'll continue to maintain communication with state representatives. In terms of the announcement, I think that's probably something that we'll work out with the state as to how that's going to be announced. And as far as being told ahead of time, I think that's we'll have to just ask. We'll make sure that the state knows that we'd like a warning before the notice goes out.
Thank you for that. Another question: how big of a role do you or does the county health department play when the state decides whether to roll back reopening?
So the state of California, the state health officer for California has the authority to issue orders that are effective at the county level. So that's in addition to every local county or city health officer's authority as well. So if the state health officer issues an order, then those orders are in effect in the county in which it's ordered. So should the state health officer issue an order here in Monterey County, then it is an order that can be enforced locally. In terms of enforcement, we really still are dependent upon law enforcement, dependent upon city officials, the mayors, chiefs of police, and the public to enforce, and the business owners, of course, to enforce, implement and enforce local or state health officer orders. So we all need to work together. We all need to do what we can. Everyone has a role to play in making sure that we're taking measures to slow the spread of this virus.
Thank you. Another question: are contact tracing staff asking specifically about whether those testing positive for COVID have participated in a protest?
So contact tracers their job is to notify an individual that they were exposed to COVID-19. And we are really, with contact tracers, really trying to explain to the person who's been exposed that they could be infectious for 14 days after they were exposed to COVID-19. We don't tell the person who's been exposed who exposed them. They might be able to figure it out for themselves, but we don't tell them who exposed them because we have to protect the privacy of the person who actually has the COVID infection. COVID-19 is still an infection and it still falls. The person under state and federal law still has a right to privacy, or still protected. I'm sorry, their privacy is still protected. And so we can't share that information with people. So the issues of where or specifics about the person who was actually infected still remains private. So contact tracers are really focused on letting people know that they've been exposed, that they could come down with symptoms, they could be infectious in 14 days, and what steps they have to take during quarantine to prevent further spread should they become infectious during their quarantine period. And in addition, if they do become symptomatic, then we will work with them to decide whether or not their symptoms are suggestive of COVID. And if it is, then they would have to be in isolation for at least an additional 10 days.
Thank you, Dr. Moreno. And here's a question that also is just into the newsroom. The state just tweeted out Monterey County will, along with other counties, have to close indoor operations for restaurants, wineries, movie theaters, zoos, museums, and card rooms. Bars must also close all operations. Do you have a comment on this, and have you gotten word on this?
So I've been on this call for the lunch hour, so I haven't had a chance to look at my emails, but I wasn't notified that I know of prior to this call. So my comment would be that we will continue to work with the state. We were concerned that we were on the watch list, and we were knowing we knew that there was a chance it would be on the list. So what I'll do is thank you for sharing that. I'll verify that and work with the state on how we're going to implement this.
Thank you. And then one more question related to cases that the original question was regarding protest, but this particular reporter is following up on that, talking about your concerns about Mother's Day and Memorial Day events in terms of COVID cases. Has the health department confirmed any cases stemming from public protests similar to your concerns about family events and Mother's Day and Memorial Day?
Yeah, so all I could say is that a lot of those cases that we're seeing are tied to exposures in the workplace or workplace related, and actually a lot of them it's related to household contacts. That's really where we're seeing a lot of the exposure. So seeing several people in single households, at least in single address or a household, coming down with symptoms after one person gets exposed and develops symptoms. So that's really where we're seeing it. I don't have anything to report in terms of activities like people who were demonstrating for a variety of reasons here in Monterey County.
Thank you for that. And then and then here's a question about how we just learned about the information from the state via Twitter. What do you think of the state's communication regarding the watch list, especially that it was just announced via Twitter?
Mm-hmm. So I think we've had pretty good communication with the California Department of Public Health staff. So this is not a surprise to hear this. So we had good communication with them. So and we'll continue to work with them moving forward to find ways to implement and in such a way that it's effective. That whatever we do here in Monterey County is effective.
All right, thank you for that. And I got another question in that's related to a previous question about protests, and I'm going to forward that question to Dr. Moreno for what you're asking for, rather than address it here because we've already asked the question several times. But I'll try to get you the answer that you want. So I'm going to move on to our next question. What should businesses affected by this rollback of the reopening begin to do? When could they expect closure?
Thanks. So really what I need to do is I need to get in contact with the state to identify in writing what the specifics are of the guidance before I could comment on it.
Okay, thank you. And then any other questions for any of our presenters for today? That was our last chat question. And let me see, I don't see any hands up. So that will end our media briefing for today. Our next briefing will be Friday, and we'll see you then.